Doctors of Reddit. What's the biggest case of faking it you've ever seen? Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking. Tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh. And of course his eyes were back to normal and focused. Sorta along the same idea, working at a pharmacy we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt, we told him again we could not refill it. One of the other employees saw his step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly, drawing blood. He calmly left and went to the ear. He came back a few hours later with a prescription for pain meds. Seriously, please like and subscribe and comment something nice for your favorite Reddit slave. A nurse. Bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with a specimen cup that literally has a piece of concrete in it. Looked him in the eye expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. I'm a nurse, but not a doctor. I had a patient who worked in a hospital, janitor, so he knew enough to fake a bit. He was seeking pain meds, complaining of chest pain, wanting morphine. He was worked up for everything cardiac and was fine. Then he tried to claim GI discomfort when he was being discharged. Cleared again for everything. Faked chest pain again. Cleared again. Now here's my patient. I am a new face. Here's telling me here's having abdominal pain. I call the doctor, knowing this guy's history. He says he'll be up to see him soon. This patient wants a ginger ale, some stomach ache. I decide to go to lunch. My coworker comes into the lunchroom. Disgusted. This guy had taken a dump in a basin and then dumped the ginger ale over it and tried to tell her he'd had fecal vomiting. He obviously needed Dilaudid right now for the pain. I walked into his room and sure enough, a pile of shit in a puddle of ginger ale. I told him I would have to take away his food and drinks and when I'd have to put an NG down. Suddenly he changed his tune. He admitted to faking it. Why do these people do what they do? Question mark? Question mark? In the story, opioids. My husband is an attorney. He once had a prospective juror pretend to faint and seize on the floor of the courtroom to get out of jury duty. The judge was not having it and called an ambulance. The woman refused to back down. The ambulance came, put the woman on a gurney and rolled her out of the courtroom. As soon as she was outside, she jumped off the gurney and said audibly, "Bye everyone. Ha!" Exclamation mark. And walked off. Well, too bad one of the sheriff's bailiffs heard her and reported her back to the judge. He charged her with contempt of court and ordered her to return a few weeks later. My brother was an EMT for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego because the hospital is in Oswego by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. Obligatory, not a doctor. I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions and signed it off, the guy asks the doctor to check his shoulder, which doc does, and asks how he injured it. Guy says playing rugby for a competitive team. Really, says doc. How long have you been playing for them? Guy has been playing and training the whole time. Doc puts this info on insurance form. Doc loses his shit in staff room laughing. Next week the patient loses his shit in reception because his insurance has been cancelled. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual line crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call, but had to take a backstreets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic with her I'm crippled jet up on again. A few weeks later I got the subpoena for the deposition, and it all became clear. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated oh wave. She started to throw her arm up too, but caught herself halfway through, then threw her hand back into her lap and pretended to be starring go off into nothing. This patient comes in for back pain with weakness of the legs, gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. Patient is seen by physical therapy and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. Patient is infuriated that they are being discharged, yelling and screaming about how they aren't better, how they are disappointed in the institution, blah blah blah. They said one particular thing that still clearly stands out 34 years later. I can't believe you're sending me home already. I haven't even told my family I'm here, and now you're going to send me home before they even have the chance to see me. My attending and I leave the room to arrange things with the nurses. We go back in, and the patient is out of bed and standing up in the middle of the room. Miraculously the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. They were discharged home after a conversation regarding abusive medical services. Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot, wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk, hips swaying, full stride, going places. We were all fools. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with the Tonopin, a device you poke them directly into the eye with, and they go, "What the fuck is that thing?" Question mark? Exclamation mark. Question mark? Exclamation mark. Question mark? Exclamation mark. Question mark? Exclamation mark. I once saw a patient who had been faking paralysis of the legs for years, used a wheelchair, never walked, etc. Old records showed extensive imaging, neurology consults, and other tests that proved the patient had full function of all extremities. Family/friends were just going along with it, not sure if it was really conversion disorder or if the patient had some secondary gain issue. Not a doctor, but I'm a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She would call saying that she had bled down the toilet but flushed it, and all the examinations we did came back completely normal with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations when I'd see the smallest amount of blood, I was caring for her during a shift where she yet again called to say she was bleeding. Walked into her room and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave, because she had 5 noisy children at home, needed some rest, and knew we would not admit her to hospital if it was not for a good reason. She would do it anytime her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. A patient claimed to have all kinds of illnesses and would cough every minute or so. Have you tried coughing when you don't need to? It's like a normal cough, but you take the subwoofer away. Now imagine that, but 10 times more fake. Guy came to her, I was a nurse at the time, for stomachache. When asking him about history, he randomly mentions a fight with his girlfriend, where she left in a tizzy and he fell asleep on the couch. 20 minutes later, when we see the court, he has a satellite cable remote wrapped in a condom lodged in his rectum. I suppose he intended to frame a Did not get to hear the conversation he had with the doctor. I was curious how he was going to explain why she was nice enough to wrap it in the condom. I had a patient when I worked in a ICU that was sedated, and on a vent, a family member showed up out of nowhere and was staying day and night. I got pretty suspicious of them because they were clearly lying about knowing this person. Just talked to the fake family member about how it must have been sad since they just celebrated their birthday a week or so before getting ill. This person said it was a wonderful party and such, to which I replied their birthday hadn't occurred yet and won't for months. Turned out when security came, it was a homeless person who snuck in and found a room with a sedated patient and decided to make it a place to stay. Needless to say, security to enter the ICU was absolute shit. 4th year medical student. On my rotation, and a trauma came in from a woman that had been arrested. During the drive, the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor. Did not even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay, though some of the nurses said that they caught her working at us when would leave the room. We ended up getting a cord scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids, and held them open while telling her to wake up. Finally she started fighting to close her eyes and the jig was up. The doctor called her out and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury.